I'm going to pass this over to Dr. Janet Craig, our Edmonton Zone physician champion. Janet is from Glenora Medical Clinic, part of the Edmonton West PCN. Janet, may I ask you to start off wearing your Edmonton Zone physician champion hat and talk about how CII CPAR fits with the work that the zone has prioritized?
Thanks, Gina. Next slide, please. So the Edmonton Zone has got 3 priorities for the zone, and you can see them on the slide. From Wayne's story, we can see that CII CPAR fits really well into those priorities. So it helps us with specialty access. If a specialist signs up for CII, then the consult letters from the specialist appear on NetCare. And if a family physician signs up for CII CPAR, they can see when their patients have been in emergency or in hospital. And then if we look on the left at the patient's medical home model, we can see that 2 of the elements really flow well with CII CPAR, the enhanced access and the panel and continuity. Next slide, please. If you've been attending some of the AMA webinars, you will have seen this. This is just a reminder for you that there's a lot of great information on this document, and Barb will put up the link for it in the chat box. And, give you an example. If you find out that one of your patients has been to emergency and was tested for COVID, and you check on NetCare and find out that they tested positive, then you could refer to this algorithm and refer to the COVID-19 primary care pathway, and that would give you a nice guideline as to how to manage them in the community. And if you needed any help from specialists, it gives you those links as well. So there's some really good information on this algorithm, and if you haven't seen it before, I strongly recommend that you have a look at it. Next slide, please. So why did we get involved at my clinic? Well, yes, in Edmonton, we have a legacy feature on NetCare that allows us to pull up a list of our patients that are in hospital. But you have to remember to do that once or twice a day. And if you're away or you don't do it on the weekend, you could miss seeing that your patients have been in hospital. So now I get e-notifications under lab results in my EMR twice a day. So 6 a.m. and 2 p.m. they come, they're there, and they're there until I look at them and mark them as read. So now I'm getting notified when my patients are in hospital and in emergency. So that was from our clinic's point of view why we wanted to get involved. So let me talk a little bit about how much involvement there was, how much time, and who did what. So often physicians will ask me what's involved. Well, at our clinic, we just held a lunch meeting so that the physicians and staff could learn about what CPAR CII is and isn't and get their initial questions answered. After that, the rest of the physicians really weren't very involved, and I was the team lead. So the only other thing I really did was I had a meeting with my EMR. Our clinic is with HealthQuest, which is the MicroQuest product. And that particular EMR has some choices how you map your information going to CII CPAR. Not all the EMRs are like that, but HealthQuest, there are some choices you have to make. So I found my EMR consultant to be very helpful, and she helped me make some decisions how we were gonna put the fields and that we enter information that gets uploaded to CII. Now, my clinic manager did most of the work, but she would say that it went very smoothly and was pretty easy. There was some paperwork, but it was pretty straightforward. And if she did have any questions, she had 3 people that she could ask them for help. So there was an e-health consultant through Alberta Health. Our PCN practice facilitator helped out, and also our ACTT consultant. So it really was a team effort, and together it went very smoothly. Next slide, please. So what were the lessons that our clinic learned during implementation? And I have to say that we are quite new to CII CPAR. So I think it's really important that your clinic team and your physicians know what CPAR CII is and isn't, and what information will and will not be going to Netcare. If you're on MicroQuest, it's really great to talk to them about data mapping options, and maybe talk to another clinic that's on CII CPAR and see what they did, so you can learn from them. And just another tip is that the first time you run your demographic mismatch report, it might be a little bit big. Now, when I say big, our first one was 27 patients. So, I mean, it's not huge, but there were a lot of minor errors, maybe one numeral mixed up in the birth date, or maybe a patient's first name had been recorded as Kim and it should have been her legal name, Kimberly, something like that. So once we cleaned all those up, the rest of the reports going forward are very small in number, 0, 1, or 2 patients at a time. So once you do that first demographic mismatch report, after that, it's much easier. Next slide, please. So what was our biggest challenge? Well, like I said, we went live fairly recently. So it was during the COVID-19 pandemic, and not all the physicians and staff members were in the clinic at the same time. So there was a bit of a challenge doing the training and just communicating, but we were able to have a Zoom session, and we went from there. So in the end, it really was quite smooth, and we didn't have any major problems. We were lucky our PIA was up to date, so we didn't have to do any work there. And I know Tara's going to talk later about the PIA and updating it and so on. So I'll leave it to her to speak about that a little later. Next slide, please. So just finally a story. Since we went live on CPAR CII, I got 2 notifications that patients of mine were being discharged from obstetrics. So what I did was I went on Netcare to make sure that they had delivered and that they weren't just admitted for a prenatal issue. And I found out that yes, both of these women had delivered babies. So then I phoned their cell phones and just left a brief message, saying, congratulations. I'd like to see you and the baby in the office in 1 to 2 weeks, but if you're having any issues, please call sooner. Well, both of those ladies called me either the same day or the next day and told me that they were having issues with breastfeeding and jaundice. And I was able to liaise with Healthy Beginnings, and we sort of had a plan, and we were able to do that work before they came to the office. And I would not have known that they had delivered and been discharged were it not for CPAR, because I still haven't gotten an official discharge summary about these 2 women that delivered earlier in May. So that's just a story about how CPAR CII can really help you and help your patients.